Hi, I'm Amandeep and I'm the manager for Biomedical Engineering at Windsor Regional Hospital. We're standing today in the middle of the Biomed shop at the Olette campus. So I'm sure you're wondering what Biomed does at a hospital. We're responsible for servicing and maintaining all the medical equipment in the hospital. Something simple as a thermometer, all the way to complex machines such as the anesthesia machine. I've been working at Windsor Regional for about 19 years. As much as I'd like to say we've come out of the dark ages, we're still far behind in technology. To my right, I have an older cautery machine. This is something that I started working on when I first joined Windsor Regional. We were doing all of our repairs and calibrations manually. We were doing our repairs on the boards, removing resistors, removing capacitors. Everything was analog. Slowly, over the last 19 years, technology has evolved, and so is our fleet of inventory. We have a lot more bells and whistles on our equipment, a lot more color, and our repairs are not surface mount board repairs anymore. They're more modular. Calibrations are done through service portals. They're open through vendors. There's a lot of equipment that's integrated, and everything works together and talks together. On any given day, I have staff working through the hospital, and we're called for various number of things. For example, we could be called to NICU for an incubator that's failing. We could be called to family birthing. We have a radiant warmer that's overheating. We could be called to the operating room where we have a gas machine that's not providing sufficient output for the patient care. It would be called even to emerge. The thermometer's not working and it's giving a wrong reading. So we're busy people, and our phones don't stop ringing from the moment we come in, and sometimes even through the night. This is very important work we're doing because it's ensuring that our patients are getting the best care they can get. Our equipment helps diagnose and treat equipment, and if it's not working properly, well, that's a big concern. Here's a funny story. At Olette campus, our patient monitors are over 14 years old, and secretly I can tell you they don't have touch screen. But I walked into one of the bays in the recovery room and found a new nurse touching the screen. She's like, it's not working. What's wrong with it? The touch screen's not working. And we had to bring her to the reality that we were not that far ahead, and then everything had to be adjusted by the turn knob. That's just one of the realities of working in a hospital, where we're advancing or trying to make advances in different areas, but it's just the pace that we do it at. One of the things that my team and I are looking forward to and being a part of is this new hospital. Our imaginations could go wild. We could have equipment that would fulfill the needs for treating our patients at every level. Everything would be integrated. We'd have dashboards which would provide us feedback loops on a constant basis. So we could look at things before they ultimately explode and go down. That would help with workflow, and it would also help with downtime, making sure that our patients are getting access to medical equipment without any interruptions.